Now on this video we want to look at the gastrointestinal tract again, but in the context of the rest of the body and whole body anatomy. So first of all we see the thoracic cavity. The diaphragm is separating the abdominal cavity below from the thoracic cavity above. And the bulk of the digestive system, the bulk of the gastrointestinal tract is inside the abdominal cavity, but there is some in the pelvic cavity below as well. So let's start at the top and look down through the tract. So again, here we see the nasal cavities, and that bit at the back there connecting the nasal cavity with the oral cavity is the pharynx, nasopharynx, oropharynx, and we can't see below here, but that would be the laryngopharynx further down. Here we've got the bone of the maxilla, hard palate. This bit at the back is called the soft palate. The upper teeth, the lower teeth in the mandible. Here we see some salivary glands, 3 pairs of salivary glands. And if I turn it round here, actually we can see the upper pair of salivary glands. We can only see one on this side, of course. That's the parotid salivary gland, with the duct taking the saliva down into the mouth. Now when the patient swallows, or when the individual swallows, the food goes down over the top of the airway, over the top of the glottis. The top of the airway is protected by the epiglottis, and it goes down through the neck and into the thoracic cavity. Now the trachea here is at the front, so of course we can't see the esophagus below. But let's just take out the lungs and take out the heart. And here we can see that the trachea is divided into the left main bronchus and the right main bronchus. But here we see the esophagus going down posteriorly behind the heart. So the wave of peristalsis carrying the bolus of food down through the esophagus, and that goes through the diaphragm into the abdominal cavity. First of all, we notice the large liver on the right side, which we're just going to take out now. So here we have the liver that we've taken out. Underneath the liver, we see the gallbladder and the bile ducts, and as we noted before, the hepatic portal vein. And we notice that the esophagus here is going through the diaphragm. So this is the domed muscular wall of the diaphragm, starting from the bottom ribs going up and doming up the way. The esophagus is going through the diaphragm into the top part of the stomach. Remember, the stomach, the top part is the fundus, the body, and the pylorus. The cardiac sphincter is between the esophagus and the body of the stomach. Just taking the stomach out there, it comes out whole. So here, this would be the distal part of the esophagus. This is the area of the cardiac sphincter. So fundus, body, pylorus of the stomach. And here, this is the junction between the pylorus and the duodenum. And this area is the pyloric sphincter. Here we have the duodenum, the first 25 centimetres of the small intestine, going into the jejunum and ileum. We see the pancreas the head, the body and the tail of the pancreas, the pancreatic duct, taking digestive enzymes into the duodenum. And on the left here, this structure is the spleen. On this model, we see the yellow fatty omentum, the apron-like fold going down over the anterior surface of the intestine. The omentum is sometimes described as the policeman of the abdomen. It goes to areas where there is infection or inflammation and can wall it off. And the omentum also stores fat, so visceral fat is partly stored in the omentum. Going down through the gastrointestinal tract, the material goes into the duodenum, to the jejunum, to the ileum. And here we see the first part of the large intestine, the cecum. Maybe we can take this off. Yep. And here we can see the first part of the colon, the large intestine, the cecum. Going up into the ascending colon. We can't see the appendix in this model, but we know that the appendix is a blind-ended tube projecting from the cecum. Going up the ascending colon, the bend by the liver, the hepatic flexure, the transverse colon. We notice that the duodenum is behind, is posterior to the anterior at the front, the transverse colon. So, ascending colon, hepatic flexure, transverse colon. Here is the bend by the spleen, the splenic flexure. The colon goes down, in this case behind the omentum, so we can't see it very well. The descending colon. And then we know the sigmoid colon goes back to the rectum. And if we take this out, we can see some more. So, just remind ourselves this is the ascending colon seen from the back. And here on this model we do actually see the appendix just there projecting from the cecum. The ascending colon, this is the hepatic flexure here, transverse colon. That makes this the splenic flexure, descending colon, sigmoid colon going on here. So this bit here is going to connect with this bit here, because remember that's come out that way, like that. So this bit here is the end of the sigmoid colon, this is the rectum, and behind we would have the anus. And also in the pelvic cavity we notice the urinary bladder, collecting urine from the ureters. Here we have the ureters. Coming down from the kidneys. Here we see the right ureter going down to the bladder from the right kidney. And just for further orientation we see the suprarenal glands or the adrenal glands, one on top of each kidney. Here we see the aorta, and this is the inferior vena cava at the back of the abdominal cavity.